Hi, I'm Shea Lawrence, and I'm going to be discussing lupus with you today. Now, lupus is an autoimmune disease, which means that the immune system in the body attacks its own cells, tissues, and organs. In fact, it fails to identify your own healthy body cells and the invaders that are coming into your system. The Mayo Clinic talks of lupus and says that the inflammation caused by lupus will attack joints, the skin, kidneys, lungs, the heart, the brain, and the blood cells. To this day, there are no current causes for lupus. However, there are a few factors that are believed to contribute to the development of lupus, and those factors are hormones, genetics, and the environment. Now, hormones. According to the Lupus Foundation of America in 2022, 9 of 10 people diagnosed with lupus are female. So there's great consideration of how estrogen may be a contributing factor. However, studies also show that women with lupus taking estrogen in the form of birth control or for postmenopausal treatment have had no increase in significant disease activity. More research needs to be done on hormones. Second is genetics. Over 50 genes have been identified in correlation with the development of lupus. However, simply having the genes does not lead to lupus in and of itself. In 1948, research discovered a lupus erythematosus cell that is directly associated with lupus. And according to Choi and Kostenbader in 2022, the lupus erythematosus cell provided evidence that autoantibodies are a key player in the role of identifying systemic lupus pathogenesis, which is generated by a dysregulated immune system leading to complex formation and deposition and subsequent inflammation and organ damage. It's still unknown why this cell occurs in the body. However, it led to some very big breakthroughs in leading to anti-nuclear antibody tests that help diagnose lupus. And lastly, environment. The environment may play an extremely important role with factors such as viruses that attack the immune system, as well as contact with certain chemicals, in combination with a genetic susceptibility may trigger the development of lupus. Ultraviolet light has also been associated and identified as aggravating a lupus flare-up. So anybody who already has lupus, if they spend a lot of time in the sun, it may have aggravated signs and symptoms due to the ultraviolet light. Now, symptoms of lupus are complicated as the autoimmune in and of itself presents with a variation of many generalized symptoms, and is often confused with other disease processes, and it's very dependent on the organ system that's being attacked. The Mayo Clinic says that no two cases are alike, and signs and symptoms may come on suddenly. They may develop slowly. Some are mild, some are severe, some symptoms are temporary, and some may be permanent. But some of the generalized symptoms listed by the Mayo Clinic in 2022 were fatigue, fever, joint pain, stiffness, swelling, a butterfly rash that's prevalent in about 50% of cases, skin lesions, shortness of breath, chest pain, dry eyes, and headaches. Again, those symptoms will vary dependent on which organ systems are being attacked, and every person will experience those symptoms differently. Treatment. There is no current cure for lupus, and the treatment protocol is to slow the immune system response and trying to lower the inflammation and damage that is occurring within the system, and to overall manage flare-ups. Now, flare-ups are defined by the Lupus Foundation as measurable increase in disease activity in one or more organ systems involving new or worse clinical signs and symptoms. So it's very important to manage those flare-ups, as those flare-ups will lead to increased damage to the organ systems and widespread inflammation. According to the American College of Rheumatology in 2022, hydroxychloroquine or Plaquenil is prescribed along with prednisone, which is a fast-acting drug to treat lupus flare-ups, and it's been most effective and helps prevent and limit inflammation, therefore limiting damage to the body. Again, there are many immunosuppressant drugs that can be used, many different steroids that can be used, and other treatments that may accompany that treatment protocol based on the organ systems being impacted. However, the hydroxychloroquine and the prednisone seem to be a prevalent treatment plan. The treatment does provide hope to those living with lupus, as it will extend their life and assist in managing those flare-ups. Now, the prevalence of lupus is also very difficult to determine because lupus is extremely difficult to diagnose and it has a range of signs and symptoms, and it is not a reportable disease. So it's very difficult to find accurate prevalence numbers. Another challenge is that researchers are having a hard time agreeing upon the proper lupus criteria, whether going for any form of lupus versus a systemic lupus. But the CDC specifically states that due to the lack of good research to identify it, it doesn't really have any numbers. However, they did design an algorithm in the 2000s based on a 2018 census that the National Resource Center for Lupus used in an estimate in 2018 that approximately 1.5 million Americans and about 5 million worldwide have some form of lupus, and they estimate another 16,000 new diagnoses a year. But again, data is very limited and it's difficult to truly know. The prognosis for lupus is case dependent, and it's dependent on the severity and the organs impacted. Overall, the prognosis is quite good and lupus is manageable. The Lupus Foundation states that with close follow-up of treatment, 80 to 90% of people with lupus can expect to live a normal lifespan, but that will include potentially many flare-ups and pain. In more severe cases, it may be more difficult to control and may have more dim prognosis. It may become even life-threatening in the cases of severe flare-ups. So maintaining a healthy lifestyle, close follow-up with your doctor, and trying to limit those flare-ups are the keys to living a good and relatively healthy life with lupus. Thanks for listening, and I hope you guys learned a little bit about lupus. Have a good one.